Hello, everyone, and welcome to our question lab. We're happy to have you here tonight as we discuss cardiology. Leading our session today, once again, is Dr. Paras Vakaria, and he's going to introduce himself now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident at UT Southwestern here in Dallas, Texas. I originally graduated from pharmacy school in Missouri and then went back home to Michigan to do medical school. I'm also an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1, Step 2 CK as well, and I'm happy to help lead tonight's session.
So without any further ado, let's go ahead and begin with our first question this evening on the topic of cardiology. As you can see, the answer choices are covered up. That is by design. We do that so that you're not jaded by the answer choices, so that you don't see an answer choice that you're unfamiliar with, which may cause you to panic, and also so you don't see an answer choice which distracts you as you're trying to read the vignette. So I've gone ahead and removed those answer choices for you, and we will begin then with the lead-in. The lead-in is the last sentence or the question itself, and we read that first because we want you to know what the test writer is asking while you read that vignette, so you can pick up on all those relevant clues and not have to reread that question and waste valuable time on testing. So let's go ahead and take a look at that lead-in. Which of the following is a complication of this patient's most likely diagnosis? Which of the following is a complication of this patient's most likely diagnosis? Once we read the lead-in, we like to ask our students how many steps they believe this question will require. And we do this so that you can have an organized thought process as you approach the question. An example of a one-step question could be where you're asked for the diagnosis. An example of a two-step question could be where you're asked for the treatment for a diagnosis. And an example of a three-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So with that, please let us know in the question box how many steps you believe this question will require, and then we'll read the vignette. All right, I see the responses coming in. Let's go ahead and take a look at that vignette. A 79-year-old man comes to his physician with dizziness and shortness of breath, saying that he can't swim his usual laps without feeling like he is going to lose consciousness. On examination, he has a loud, late peaking systolic murmur at the right upper sternal border and a low volume, slow rising carotid pulse. Which of the following is a complication of this patient's most likely diagnosis? I want all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So starting off, generally, the first thing that you're going to be given in a question is the demographics. And in this case, we're told it's a 79-year-old man. Okay, so definitely want to make note of that. Right off the bat, you can start thinking about certain diagnoses, and you can start to get your differential diagnosis working, okay? Then usually they'll tell you, why did they come to the ER? Why did they come to the hospital? Why did they come to the physician? And in this case, it's because of dizziness and shortness of breath. So you definitely want to make note of the presenting signs and symptoms. A lot of times they'll also tell you just how long it's been going on. Has it been going on for a few hours, a few months? And that chronicity is also important to make note of. We're not told that too much here, but in future questions, you may be told that. They then give us some very specific examination findings. So a kind of concise question here, jumping right into exam findings. And then we're told about some important cardiac findings on physical exam, okay? So obviously important to make note of that, to process it. And then they're asking us about a complication of the most likely diagnosis. So how many steps is this question? Well, one, I think we need to come up with the most likely diagnosis. And then two, what would be a complication of that diagnosis? So I think this is a nice two-step question here. So what we're going to do is we're going to go ahead and take a look at the answer choices. And what we have here are 5 answer choices. And what we recommend is that when you're going through the answer choices, that you start at the bottom and that you work your way up to the top. Okay, so in this example, we would start with answer choice E and then work our way up to the top answer choice A. And the reason we recommend that is, a lot of times we'll see students, they'll start at the top, they'll see something they like, and they'll select it without having gone through all the answer choices, and sometimes they'll get that question wrong. So it's important to not bias yourself that way, and that's why we recommend, one of the reasons why we recommend doing it this way. So we'll go ahead and do it, go through those answer choices now. Answer choice E, varicose veins. D, pulmonary interstitial fibrosis. C, lower extremity claudication. B, diastolic dysfunction. And A, cholesterol emboli syndrome. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paras. The poll is open. Once again, we'll wait until about 2/3 of you have responded, and then we will go over the correct and incorrect answer choices. So I'll give all of you a few moments here to select what you believe is the best answer. Keep in mind that there is no penalty for guessing on test day, so you should never leave a question blank. If you're unsure tonight of what the answer is, don't worry. Take your best guess, and we'll review it together momentarily. All right, looks like there's a clear favorite, so let's take a look and see what all of you selected. Looks like 64% of you selected diastolic dysfunction. In second place, and distant second place, was lower extremity claudication. So let's take a look and see what the correct answer is. And the correct answer indeed is B. 64% of you got it right, so we're off to a great start. Let me hand it off back once again to Paras.
Thank you, Sean. Yes, great job with this question, guys. So let's take a look at this patient. So we have an elderly patient here who's now coming in with dizziness and shortness of breath, especially on exertion. He can't swim his usual laps, okay? He's also maybe starting to get a little syncopal on exertion, okay? Feels like he's gonna lose consciousness. So this patient likely has aortic stenosis, okay? It's the most common valvular heart disease in adult patients, specifically elderly patients. What ends up happening is you have decreased blood flow across that valve, okay? And that can manifest as poor blood flow to vital organs such as the brain, the lung, the heart, okay? That's why you can have some of those signs and symptoms. So if we take a look at the next slide, Sean has gone ahead and pulled up some nice tables from first aid. So we can see here with aortic stenosis, okay? It is a crescendo-decrescendo systolic ejection murmur. It can lead to syncope or syncopal-like symptoms, angina, and dyspnea on exertion. And in elderly patients, it's most commonly related to calcification, okay? On top of that, you can have pulsus parvus et tardus. So carotid pulses can be weak and they can be delayed. So think of that blood flow as kind of getting delayed across that stenotic aortic valve, and thus it's a little delayed getting to the carotids, okay? And we saw that in this patient as well, okay? Now, if you take a look at the bottom, that pressure volume table, you can see there in aortic stenosis, what ends up happening is you get an increase in left ventricular pressure, okay? You have less blood being able to make it across that stenotic aortic valve, so you have a little bit of buildup and some pressure building up in your left ventricle, okay? With the decreased stroke volume. Over time, that leads to hypertrophy of the left ventricle. So you can get ventricular hypertrophy leading to decreased compliance, okay? So let's take a look at the next slide. There's another table there, and you can see here, this is kind of talking about heart failure, but if you look specifically at diastolic dysfunction, you can see there that diastolic dysfunction usually results from decreased compliance, often due to secondary to myocardial hypertrophy. It's that third line in that table. So in this patient who is presenting with myocardial hypertrophy due to aortic stenosis, or who could have this, you can then see why they could then get diastolic dysfunction. Okay. So if we go back to our question in our vignette, hopefully you guys are now able to see why this patient has aortic stenosis and why this patient is at risk for diastolic dysfunction. So we'll take a look back at the vignette. We'll take a look back at the other answer choices in case you selected those. So varicose veins, these are commonly age-related due to valve incompetence in the veins, not within the heart, so a little bit of a different issue. Interstitial fibrosis, this is a complication of a lot of other things like infections or autoimmune diseases, not what's going on here in this question. Lower extremity claudication, that's usually caused by either atherosclerotic buildup in the arteries of the lower extremities or occlusion, less so with aortic stenosis. And lastly, cholesterol emboli. This could shoot off little emboli to various organs and lead to organ dysfunction, but not a risk. This patient's condition of aortic stenosis is not a risk factor for cholesterol emboli. That would be more so if you had an invasive procedure done, like an angiography, that dislodged some of the atherosclerotic plaques. So great job with this question.
Excellent. Thank you, Paros. Yes, great job, everyone. Let's go ahead and keep that momentum going as we do our second question on cardiology. Once again, the answer choices are covered up. That is by design, and we will begin with the lead-in. Which of the following best describes the mechanism of action of the new medication? Which of the following best describes the mechanism of action of the new medication? I'll give all of you a few seconds to let us know in the question box how many steps you believe this question will require. Then we'll begin with the vignette. All right, I see some responses coming in. Let's go ahead and read that vignette. A 45-year-old man comes to the office for a follow-up appointment. He has a history of hypertension, and despite treatment with hydrochlorothiazide, valsartan, and amlodipine, his blood pressure 3 weeks ago was 168/95. Today, his blood pressure is 160/90. He is prescribed a centrally acting medication for additional hypertension control and is counseled on the importance of compliance because suddenly stopping this medication can cause a severe increase in blood pressure. Which of the following best describes the mechanism of action of the new medication? Paros.
Thank you, Sean. So once again, we're going to go ahead through this vignette and the lead-in and show you what we think are the important clues. So now we have a little bit of a younger patient, a 45-year-old man. So important to take note of that. He's coming in just for a follow-up appointment, okay? They do give us some medical history and medication history as well, okay? You know, we see some blood pressure readings, which are important because they just told us about blood pressure medications he was on. So definitely want to make note of that, okay? And then they talk specifically about a new medication being prescribed. They tell us it is centrally acting, so that's a little bit about the mechanism. That'll give us some clues, okay? And with this medication, they tell us it's important to be compliant because suddenly stopping it can lead to a severe increase in blood pressure. So that, hopefully, they're giving us a very important clue as to maybe what is this medication, okay? So important to make note of those. So then they're asking us to what best describes the mechanism of action of this new medication. So I think we've got a couple steps here. I think one, we've got to figure out what is that new medication based off the clues in that question. And then two, what is the mechanism of action of that new medication? So I think a two-step question here. Now, note we did also highlight best describe. So it will be important to go, as you go through those answer choices, to make note of what would be the best description of the mechanism of action. Okay, so let's go ahead and take a look at those answer choices. And once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, inhibition of angiotensin converting enzyme. D, beta-1 adrenergic receptor antagonism. C, alpha-2 adrenergic receptor antagonism. B, alpha-2 adrenergic receptor agonism. And A, alpha-1 adrenergic receptor antagonism. So make sure you take a good look at those answer choices. We're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here. We'll talk about it in just a few seconds.
Excellent. Thank you, Paros. Yes, the poll is open. And we'll wait until about 2/3 of you have responded once again. Next week's topic is epidemiology. We hope you'll join us. We do these question labs every Tuesday at 8 p.m. Eastern. All right. Let's take a look and see what you selected. Once again, there seems to be a clear favorite. 43% of you selected alpha-2 adrenergic receptor agonism, and 33% of you selected alpha-1 adrenergic receptor antagonism. So let's take a look and see what the correct answer is. And the correct answer is B, alpha-2 adrenergic receptor agonism. And with that, I'll hand it off to Paros.
Thank you, Sean. Yes, great job as well with this question. A little bit of a tougher question here. So let's take a look at what's going on. So we've got a patient with what we would call resistant hypertension. So still having hypertension, even though he's on 3 medications, okay? So the next thing is they add another medication. And the medication they're getting at is Clonidine, okay? Clonidine is a presynaptic alpha-2 adrenergic receptor agonist, AG, agonist, okay? It is a centrally acting antihypertensive medication. The way it works is it decreases sympathetic outflow from the central nervous system, okay? So you get a little bit of decrease in vascular resistance, a little bit of decrease in blood pressure, okay? So let's take a look at the next slide, and this is a table from First Aid talking about some of those sympatholytics. Clonidine is an alpha-2 agonist, okay? Some of the side effects, bradycardia, hypotension, and you can see there rebound hypertension with abrupt cessation, okay? So abrupt discontinuation of Clonidine can lead to severe rebound hypertension. So in the future, if you ever have a patient on Clonidine and you want to take them off Clonidine, you have to slowly taper them off of it. It cannot be abruptly discontinued, okay? Thus, it's also important that they're adherent to the medication, that they don't just stop it or miss doses, because that could also lead to hypertension. So let's go and take a look back at the question again. Hopefully you can see how those clues fit up nicely with Clonidine, okay? And let's also go through the other answer choices in case you selected those and why those would be incorrect here. So answer choice E, this would be getting at ACE inhibitors. They also lower blood pressure. The thing is, they are not centrally acting and they are not associated with rebound hypertension. Answer choice D, this would be getting at beta blockers. So beta-1 selective beta blockers, okay? These actually block peripheral receptors, not central nervous system receptors. They are also usually not associated with withdrawal, although in the acute setting they can sometimes be. So the main thing that points away is whether this is centrally acting or not. Alpha-2 antagonist with answer choice C. This would actually increase blood pressure. You can tell this is the opposite of answer choice B. So alpha-2 receptor antagonism would increase blood pressure, which is obviously incorrect in this question. Lastly, answer choice A. Alpha-1 blockers such as prazosin are used for hypertension, but again, they are also not centrally acting. So also a less correct answer choice. So hopefully you guys are able to understand why that was the correct answer in this question. I'll pass it back to you, Sean.
Great, thank you, Paros. Yes, so far we're off to a great start. Let's talk briefly about RX Coach. So RX Coach, like I said, is our coaching and tutoring program. So we help students study for med school exams, for comp exams, for shelf exams, and of course for the USMLE COMLEX, as well as CBSE. So it's a very comprehensive program, and we begin if you're studying for a comp or for a USMLE or board exam with an assessment. If not, we will use your syllabus to come up with a personalized study plan. We have highly trained RX certified tutors such as Paros, who you met, and Brenda as well. And we work with you individually, gauge your strengths and weaknesses, identify any knowledge gaps if you have them, sharpen your test taking skills, and of course, work on your timing and stamina as well. So, if you're one of those students who's thinking, I'm studying a lot, I'm just not seeing the results that I want, or I'm not quite sure how to approach this, I want to be more efficient, or I just need a little bit more help and support and guidance, reach out to us at rx-coach or rx-coach.com and click on the free consultation tab to discuss our tutoring program and how it can benefit you. Okay, once again, that website is rx-coach or rx-coach.com. We've helped students pass that graduated medical school 10, 15, 20 years ago. We just saw recently an 80-point increase in the step 1 score. And of course, we have a tutor with us now who used RX Coach, did extremely well, and is now one of our tutors. So the program has been extremely successful, and we're here and happy to help and support you in any way we can. So with that, let's go ahead and move on to our third question of the evening. I would like to remind you that we have a raffle and a special offer for all of you in attendance, but you must be present to win. So make sure you stick around. You might be tonight's lucky winner. Once again, the answer choices are covered up, and we will begin with a lead-in. Norepinephrine administration in this patient would be expected to produce which of the following physiological responses? Norepinephrine administration in this patient would be expected to produce which of the following physiologic responses? I'll give all of you a few seconds here to let us know how many steps you believe this question will require, and then we'll move on once again to the lead-in. I see some responses coming in. Let's go ahead and take a look at that lead-in. The vignette, rather. A 62-year-old man admitted for bacterial pneumonia is intubated for airway protection due to altered mental status. Temperature is 38.8 Celsius or 101.8 Fahrenheit. Pulse is 133 per minute, and blood pressure is 82/40. He has a tidal volume of 450 milliliters and a fraction of inspired oxygen of 40%. Lung fields are clear to auscultation, and there is a 2/6 apical systolic murmur. Blood pressure is not improved after 3 liters of normal saline. Intravenous administration of norepinephrine is started. Norepinephrine administration in this patient would be expected to produce which of the following physiological responses? And with that, I'll hand it off to Paros.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So starting off, now we have a 62-year-old man. So again, always make note of those demographics. They then tell us he's actually admitted for pneumonia, bacterial pneumonia, and he is intubated due to altered mental status. So a little bit of a sicker patient, okay? They then give us some important vital signs, some respiratory findings, and cardiopulmonary exam findings. Okay, always important to make note of those, especially in this type of situation. They then tell us about his blood pressure, it's not getting better, and so they started norepinephrine. Now we knew off the bat, because Sean had read that lead-in question, that this question was focused on norepinephrine, okay? And they were asking us about the physiologic response, okay? So in this question, they're asking us norepinephrine in this patient, what kind of physiologic response would be expected to be produced, okay? You can see that we've highlighted those key phrases in that lead-in. Now the one thing I'll point out here is that in this question, it's asking us specifically about in this patient, okay? So not just necessarily any patient, but in this patient, what would be a possible physiologic response? It may be the same, it may be different, but important to make note of that. Okay, so how many steps is this question? Well, one, I think we've got to figure out maybe what's going on with this patient. Two, based off that, what would norepinephrine do in that patient physiologically? Okay, so I think this is at least 2 steps. There may be ways in the way the answer choice is worded, maybe there's a 3rd step, but I think there's at least 2 steps of figuring out what's going on with this patient, and then 2, what would norepinephrine do? And I think, you know, that takes into account knowing the mechanism of norepinephrine. So let's take a look at those answer choices. And then once again, I will start at the bottom. I'll work my way up to the top. Answer choice E, decrease in systemic vascular resistance. D, decrease in pupillary dilator tone. C, decrease in platelet aggregation. B, decrease in heart rate. And A, decrease in diastolic filling pressure of the heart. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer. We'll talk about it in just a few seconds.
Excellent. Poll is open. We've been doing quite well. Let's keep the momentum going for our last 2 questions here. Keep in mind that we do have a raffle and a special offer, as well as a webinar tomorrow that I'm sure Jeff will tell you about in the chat box. All right, I see the responses coming in. We'll give all of you a few more moments here. It is a tough question, so take your time. All right, I see the responses have been submitted. Let's take a look and see what you selected. It was a pretty even split. So 32% of you selected decrease in diastolic filling pressure of the heart. 30% of you selected decrease in systemic vascular resistance, and 29% of you selected decrease in heart rate. So let's take a look and see what the correct answer is. The correct answer is B, decrease in heart rate, and 29% of you got it right. So a challenging question here on the topic of cardiology, but not to worry, Boris is going to explain it to us now. Boris.
Thank you, Sean. Yes, definitely a tougher question. So what's going on? Well, this 62-year-old male, we know he has bacterial pneumonia. Now he has altered mental status. He's febrile, tachycardic, hypertensive, and he's intubated. So this patient likely has sepsis, and specifically septic shock, likely due to that pneumonia process, okay? So in this issue, in septic shock, you can have bacteria that release antigens or toxins that promote a inflammatory response within the body, and that can cause systemic vasodilation. This patient is hypotensive, okay? Now, as one of the first things you should do in these patients is give them fluids. And they did. They gave 3 liters of normal saline. However, his blood pressure is still not improving, so then they gave norepinephrine. Okay, this is a vasopressor drug. It's a drug that increases systemic venous resistance, okay? So let's go ahead and take a look at the next slide. Norepinephrine, it's one of the first-line agents for the treatment of hypotension and septic shock, okay? It increases venous return to the heart through vasoconstriction, and it increases heart contractility. So you can see there its action, the receptors it works at, alpha-1 is the greatest, but also alpha-2 and beta-1. So it increases blood pressure. Okay, that's its main effect, and that's why it's useful for hypotension and septic shock. Now, as a result of that increased blood pressure, you actually get a reflex bradycardia, okay? So the increase in peripheral vasoconstriction and the increase in blood pressure causes a reflex bradycardia, okay? So that's why in this question, decreased heart rate could be seen. Now on the next slide, there's another nice diagram in first aid that kind of walks you through a lot of the various parameters that would be altered with norepinephrine. And we know it affects alpha receptors more than beta. So we know that the blood pressure, as we talked about, is going to increase. Specifically, the mean arterial pressure is going to increase as well. And as a result, on the bottom diagram, you can see that you get a reflex bradycardia, so a decrease in heart rate, okay? Now, when it comes to peripheral resistance, we know that mainly has to do with alpha receptors. So we can see there that that alpha-1 effect is going to predominate and lead to an increase in peripheral resistance, and thus also blood pressure. So let's go back to our question hour vignette and our answer choices. Hopefully you guys will now see why a decrease in heart rate could be expected in this patient who is hypotensive. We're going to raise his blood pressure. He may get reflex bradycardia. Let's look at the other answer choices. Decrease in SVR. We actually just talked about how norepinephrine actually increases SVR through vasoconstriction. So that is actually the opposite. Decrease in pupillary dilator tone. Norepinephrine would actually cause an increase in pupillary dilator tone, okay? Alpha-1 receptors are found on the pupillary dilator muscle, and it causes contraction when activated. So norepinephrine would cause contraction, it would cause an increase in that tone of the muscle. Answer choice C, platelet aggregation. Alpha-2 adrenergic receptors can actually promote platelet aggregation when activated. So that would actually be the opposite. And then lastly, answer choice A, decrease in diastolic filling pressure of the heart. Well, we talked about how norepinephrine leads to peripheral vasoconstriction, and that would actually lead to a decrease venous return, or sorry, that would actually lead to an increase of venous return and diastolic filling pressure. So that would actually be the opposite as well. So the best answer choice here is B. Definitely a tough question.
Definitely was a tough question, but a great explanation. Hopefully all of you will nail it on test day, but even more importantly, know it when you conduct rounds and see patients in the future. Let's go ahead and move on now to our last question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following findings is most likely seen in mice undergoing physical activity? Which of the following findings is most likely seen in mice undergoing physical activity? I'll give all of you a few moments here to respond in the question box and let me know how many steps you believe this question will require. And then we will move on to the lead-in. Move on to the vignette, rather. All right, I see the responses starting to come in. Let's take a look at that vignette. A researcher is investigating the metabolic mechanisms responsible for controlling dilation and constriction of the coronary arteries. He takes blood samples from the coronary arteries of mice and analyzes the metabolites. He then compares the samples to those of mice that have been engaged in strenuous physical activity for more than 10 minutes. His study of the findings assumes the physiology of mice is similar to that of humans. Which of the following findings is most likely seen in mice undergoing physical activity? Bars.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in the vignette and the lead-in. And so we've done this a few times now, so hopefully you guys are starting to get a sense of what's important in those vignettes and the lead-in. And you can pick up on those same clues and know what's important, and you're also taking note of exactly what they're asking you in that lead-in question. So let's go ahead and do that one last time with this question. So in this situation, a researcher is investigating specifically some metabolic mechanisms in regards to the coronary arteries, okay? Usually when you have investigational questions like this, okay, they're going to give you more information about the study. They're going to maybe have two different groups, so control group and a study group. So make sure that you're taking note of all the details that can help lead you to pick up those clues in this study. Okay, And then there is an important last question there that it's assuming that mice physiology, or last statement, mice physiology is similar to human physiology. Okay. So then they're asking us about what finding would we most likely see in mice undergoing physical activity in this study. So that's obviously the important clue there. Okay. So one, I think we've got to figure out, exactly what are those metabolites that would be active in physical activity, and two, what could that possibly lead to finding-wise? So there's a chance this is a two-step question. So let's take a look at the answer choices and see what we're working with. And once again, we are going to start at the bottom and we're going to work our way up to the top. And as we can see here, this is actually a table, and we have three columns here. We have column A, nitric oxide, B, adenosine, and C, arteriovenous O2 gradient. Okay, so in answer choice E, it's saying nitric oxide and adenosine and AV O2 gradient are decreased. In answer choice D, it's saying the nitric oxide is decreased, but that adenosine and AVO2 gradient is increased. In answer choice C, it's saying that nitric oxide is increased, adenosine is decreased, and that there's no change in the AVO2 gradient. In answer choice B, it's saying that nitric oxide and adenosine are increased, but that the AVO2 gradient is decreased. And lastly, answer choice A, also saying that nitric oxide and adenosine are increased, but that the AVO2 gradient is unchanged. So make sure you're taking a good look at those arrows. We'll give you a couple seconds to take an extra look at that table. Okay. And then we will go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
All right, well, the poll is open. We'll wait for you to respond. This is our last question of the evening, and keep in mind that we do have a special offer and a raffle. You must be present to win, so we hope you will stick around. Next week's topic is epidemiology. Looks like a pretty even split so far. Give all of you a few more seconds. And let's take a look and see what you selected. So 38% of you selected answer choice A and 33% of you selected answer choice B. Let's take a look and see. The correct answer is indeed A, and 38% of you got it right. So it was a challenging question. Let's pay attention to Paris.
Thank you, Sean. So definitely a tough question. So let's take a look at what's going on here. Okay. So in this question, basically what's going on is they're asking about exercise or physical activity. Okay. In physical activity, you have increased oxygen demand, and that leads to coronary artery vasodilation. Okay. The reason you get that is because of increased adenosine and nitric oxide. These are the main controllers of vasodilation. Okay. And if you take a look at the next slide, you can see that these are some of the factors that go into vasodilation or regulation of perfusion of heart, or the heart organ, in this case, the coronary arteries. Okay, you can see there one of those metabolites is NO, or nitric oxide. Okay, so let's go back to our question. Okay, so we just said that adenosine and nitric oxide are two important vasodilatory metabolites that can increase or lead to coronary artery vasodilation in the setting of exercise. Okay. Now, this will lead to an increase in blood flow, but not a significant increase in oxygen extraction. Okay. The reason is the coronary arteries and the myocardium actually have the highest percentage of extraction of oxygen from blood of any organ in the body. So they already extract a very high percentage of oxygen from blood. They're very good at it. They're very efficient, okay? So even if you increase coronary blood flow in the setting of exercise, the heart is still going to do a great job of pulling oxygen from that blood, both in exercise and outside of exercise. So there really wouldn't be a change in oxygen in the arteriovenous oxygen gradient between exercise and rest, okay? Both during rest and exercise, the myocardium is very efficient and does a great job of pulling oxygen from the blood, okay? So that's why AbO2 gradient is unchanged between physical activity and rest. Now, we do know that nitric oxide and adenosine are released during exercise, and those would cause vasodilation. So we would expect those levels to increase. And that's why answer choice A is the best answer here, okay? The other answer choices are incorrect for various reasons. Nitric oxide would be increased as we discussed. Adenosine would also be increased. Both are vasodilatory metabolites. And as we mentioned, the oxygen gradient from the arterial side to the venous side would be relatively unchanged, regardless of if they're in physical activity or rest, as we mentioned a couple times previously. So hopefully that explains that. Great job on tonight's questions. Definitely some tough questions. Now I'll hand it back to you, Sean.
Well, thank you very much, Paris. Yes, great job, everyone. Once again, we hope to see you every week at 8 p.m. These are the question IDs for the 4 questions we dissected today. Feel free to take a picture or write these down or take a screenshot. And you can simply type these QIDs into the RX search field and review these questions further on your own time.